Kia ora. We would like to touch on a subject that has been sensitive, but we want to talk about it more. It's about suicide in male dominated industries and the effect it has on people's well being. Let's talk about some harsh facts. So, construction workers are two more times more likely to perform suicide. Out of that, 4 out of 5 men that actually do perform suicide actually die. And what I'm trying to say is, say for 2 out of 5 females that try and commit suicide still survive. So men are way more aggressive when it comes to it. It's the end. In male dominated industries, they have done some research that it's the ages between 20 and 24, and then a big gap to 45 to 49 years old, where they're most vulnerable. One horrible fact, approximately one person dies from suicide each week, and 98% of those are men. There is continuous studies why this is happening, but we can actually almost relevantly know what it is. Okay, so why should we be concerned, and what might be their concerns? So they may have relationship problems, or within that relationship, financial problems, child custody, having to deal with grief among the family, legal matters if going through a divorce, buying a house, and bullying in the industry. You'll notice this word crops up a lot. Job worries. So in construction sites, it's normally can be self-employed or subcontracted. So it's nothing that is concrete. And with the world and the recession, it's always a worry. So when they do work, they might work real long hours. They may be in pain. There could be certain conflicts with other contractors. And there's also, again, the bullying going on. The actual industry is known as have a culture of not discussing problems with mates. And if you were to discuss problems with mates, you may be put down or told to shut up and then be continuously bullied as if you were a crybaby. This is not okay. When those people start to get bullied and low, they may turn to alcohol and drug use because this has been known to be okay in this industry. Things need to change. The person may already suffer mental health, and certain triggers will escalate that. They may have certain other impairments that you don't know of, a mild depression, uh, insecurity, struggle with motivation, and struggle with inclusion. So, all these things you need to be thinking about. It's not just one shoe fits all. Everyone has a reason that may trigger them. How are we going to notice it? What's changed in their behavior? Your mate that used to be really chilled out starts to get angry. The first person that's normally all talk and bubbly has started to become isolated or distant. You notice that your mate's been drinking on Monday, Tuesday, Wednesday, Thursday, every single night, more than usual, and is coming in very sluggish from work. They could be struggling to do easy tasks, which they used to find no challenge at all. They might start turning up for work late, lack of motivation. They may not even turn up at all. These are some things that you can notice, but how can you find this out? Now, if you're a manager or boss or foreman or labourer or tradie, it doesn't matter. You have to start and step up a discussion. Certain things, hey, what's up? What are you doing? You're not the professional. You're the person that's instigating the matter. I will lead you on to where you can direct this person once you've stepped up. Make a mental health and well-being part of your working culture. If you are some type of leader, bring it into your workplace. Make sure you start up discussions. There are many apps, there are lots of tools where you just might sit down for 10 minutes, have a morning tea catch up, and give direction to discussions. Get to people open up. Make it a regular event. You be that person to ask. Be the person to ask, are you okay? And even if they say no to you, maybe tap someone else on the shoulder that they'd be more comfortable to reach out. Like I said, once you've asked, are you okay? And they say no, you're not the professional. You now need to know where to pass them on to. Also, you need to gauge yourself. How do you look after yourself? You need to gauge your mood, your health, your illness, your well being, and your emotional roller coaster. Think of how you are normally and is anything changing? If you do identify something wrong, there's going to be some tools we're going to pass on to you, but you need to conquer it before it gets out of hand. There's a great website called mates.net.nz, and that's purely for construction and tradies, but there are a lot more out there. So I'm going to show you some tools that you can reach out, but you could be the person that instigate that talk in the industry. So if you are a leader of any kind, Talk about mental wellness, which follows naturally from your health and safety talk if you've had to do that, or any kind of meeting. Know your employees, know the people that work around you. Get to know their lifestyle styles. Get to know their family, not like personally, but just to get them talking about it. Make conversation and keep it light. Have some jokes. Maybe identify one person has to bring in a joke each day just to break that ice. Talk about it and learn about mental well-being. Okay, mental well-being, health and safety all go hand in hand, as you can see. And maybe make yourself a team. If you're working for a company, you make sure that those employees feel like they're in the best company in the world. You're not alone. When you start these little tools out in your work industry, you will find that you may get people come and talk to you, and this is where you can lead them. There is so much help out there. All right. So the first step, it depends where you are. If you're here at Toya Hormai, you come to the health center. If you're not, you might want to get them to go to your doctor, or they can get them straight away to call 1737. That's an initial path. Now, if you want to speak up for someone else or get them support, these are all these websites and organizations that you can go on to see if any of these you think suits your friend or suits yourself. Now, in these websites, there are tools and resources to help you to reach out and contact phone numbers to talk. There are groups and there are individual sessions, and there is free counseling, whether it's online or you go in. It's just getting in there and accessing. There are apps on the website. Okay, look at all these different apps for different particular types of issues. And then I've also put in the bottom alcohol and drug helplines. There's the text numbers, gambling. There's the JK Depression Foundation. And then the one that's purely to do with industry is mates.nz. Reach out. There is more. I could do pages and pages and pages of things that are out there, but they're not in front of your face. You do have to come and get it. Recognize it, own it, look after yourself, and in male-dominated industries, it has the highest fatality rate. Don't let that go any further.